Oh my goodness, I can't believe this is already the sixth episode of A Divine Twist, the show that I just want to bring to the world to bring community connection resources. And today is a super epic episode because I have the incredible Janet on the show. And what I want to start bringing to the show are organizations and different resources that will support those of us navigating dystonia. So, Janet, welcome to the show.
Thank you very much. It's really my great pleasure to be here and to and to congratulate you on this program and on the effort that you're involved in and helping to do more outreach to people so they know the resources that are available to them. I think also, as importantly, to know that they're not alone in this dystonia journey. So thank you, thank you, thank you for the invitation to be here and for your efforts.
Awesome. Oh my gosh. Okay, so can you tell us, so you I mean, you are the face of share us with the listeners your role in the organization that you are connected with here for the
Sure.
listeners.
Sure, happy to. So I am Janet Hieshetter. I'm the executive director of the Dystonia Medical Research Foundation, or the DMRF. It's really been my great honor to have served in this role for almost 20 years, and to work with the people in the DMRF family and the dystonia community. The DMRF was founded 47 years ago to really fill a huge gap in information, researchers, clinicians. There was just a huge gaping hole in the universe for those who had been diagnosed with dystonia. And our founders, Sam and Fran Bellsberg, came together with others to form this organization that would work to support research, but also I think recognizing that the science can never move fast enough for those who are waiting for answers, that we needed to do more, and we needed to have programs of education and support and those kinds of things. So it's been really a great pleasure for me to work with our leadership, with the community in filling that need.
Now, what is your actual title or role with the organization, Janet?
So I'm executive director. So I'm the chief executive officer. I staff the board. It's my responsibility to work with and hire and work with the members of our team, our staff here. We have a professional staff who work here out of our headquarters in Chicago, although we have a number of people who work remotely. Our chief scientific advisor, our staff scientist, if you will, works remotely from Europe. Which is perfect because he's not a morning person and I am. So when I come in, it's late morning for him. So it's a great opportunity for us to be able to talk. And our director of communications and outreach works from Colorado, and our brain bank liaison and informational coordinator works from San Diego. So long before COVID brought remote working into the DMRF, I guess, was ahead of the game and recognized that you didn't have to physically be someplace to make a significant contribution.
Oh, I love that. Thank you for explaining that, your role. And that begs the question for me, because I'm a very curious human. And this is all really about our humanness, right? And connection. So would it be okay to ask, what was there something specific that brought you to this foundation, this group of humans? Because I'm biased. I think we're awesome humans. So is it okay to ask that?
Of course it is.
Okay,
So
I'm just curious.
yeah, it's in the weirdness of coincidences, right? So I have worked most of my career in nonprofit work. I really do feel privileged to do that. I think that there is an important role for widgets in the world. I just wouldn't be happy making widgets. So there are days when I don't deal with any of the paper that's about to fall on my desk, but I can say that I've helped one person and then I can go home feeling satisfied. I had worked for a long time in a position that I was commuting back and forth to Washington, D.C. My kids were little at the time, and it was really pretty upsetting for my daughter in particular for me to be gone so many days during the week. So I spoke with my husband and we made the decision that I would resign, and for a time didn't work, which was really weird for me because I had always had something going on since I was about 10 years old, you know, working in working in somebody's garden, babysitting, whatever it might be. And I my husband went to work one day and he came home and I had painted the kitchen purple. And he said to me, I think it's time for you to find something to do. And oddly enough, that next day I got a notice of a job offering posting for this position from a good friend of mine, and got contacted by a recruiter for the same position. And I thought, okay, I should really look into this. I had worked in neurology before and wasn't sure I wanted to go back. And then I met members of the board. I met Dr. Malin DeLong, who was our scientific director at the time. I learned how the organization has its scientific advisors present their grant reviews and their scientific discussions in front of the lay board, not behind some closed room where they're making decisions, speaking their scientific language, not being questioned by anybody. And I thought that was a really, really unique structure, and was really curious about it and thought, I want to be a part of this. So it's been the best work of my life, working for the DMRF.
What? I got angel bumps. Okay, the recruiter and the posting. Yeah.
Weird, huh? Yeah.
Well, this is it's called a divine twist. See,
Yeah.
I believe in all connections are on purpose. So I just love that, and you must like it because you're still there after all these years.
Yeah.
So
Yeah.
I also love, we talked a little bit about this before we hopped on. I don't know if it's because I'm a nurse trained as a scientist. I'm slightly obsessed with research, and it didn't even cross my mind about what you were saying about the research is presented to the lay board and not some secret, under the radar. As a person with dystonia and as a scientist and as a nurse, that is awesome to know. So I love the DMRF even more. That because I appreciate that so much. So thank you so much for sharing that. And
Yeah.
I just think there's so much richness in our stories, and I love that you shared that. Thank you for that. So
Like, could I also just
yes.
I think, there certainly is the benefit on the lay side because our leadership has the opportunity to look at the discussion, to look at the debate between the merits of a particular research project. But I don't want to overlook also the important significance to the scientist as well. Many of our scientists are basic researchers. They are PhDs. They don't see patients. And I can't tell you how many times they have expressed the value of having the people who are affected by dystonia in the room so that they have the opportunity to talk with them and have meaning to their work. So it really has been a two-way street, and a model that I would hope more patient organizations would look to replicate, because the benefits are felt throughout the organization on the scientific side and on the lay leadership side. So sorry for interrupting, but I think it's important to
No.
recognize both sides.
No apologies necessary. And again, like the whole point of being here in my interpretation is meaning. And so when you have a brilliant scientist who has these gifts, and yet you have the people that are navigating this thing that they're trying to research and improve outcomes, and Lord knows have a cure, right? There's so much power and connection in that. So that's what we're here for. So yeah, I didn't even know that was a thing. So see, I learned something new every day. So thank you for sharing that.
Sure.
Because you don't know what you don't know. So that's very powerful. So this is a perfect segue. What is the mission of the Dystonia Medical Research Foundation?
Yeah, that's a great question. Essentially, our mission is to go out of business, to close our doors forever because there is no longer a need for the work that we do. And as I mentioned earlier, Mr. and Mrs. Bellsberg recognized the importance of research from the very beginning. And as an organization, the board of directors have made a decision that the majority of our expenses every year will be focused on research to identify more effective treatments, because the treatment menu is really very limited. We all know that. But ultimately to figure out, what the mechanism is for dystonia and to develop a cure for all forms of dystonia. But as I said earlier, we know science, it's slow. And on one hand, you want it to be slow because you want it to be thorough.
Right.
So there are needs that people have as it relates to education. We want people to be informed so they can make good treatment decisions with their healthcare provider. We want them to be well aware of what the options are available to them. Awareness, it is still happening far too often that people are hearing the word dystonia for the very first time when they're diagnosed. We need to do something about that. Awareness is also important as it relates to attracting researchers to the field. So it's not just a public kind of issue. Support is also critically important. We know that dystonia can be very isolating. And it's important for people to know that they're not alone, that there's a community here, and that there are programs to help them with their dystonia journey. We also do a lot of advocacy, but I think the other thing that's interesting and significant about the DMRF's mission of research, awareness, education, and support is that has been the mission from the very beginning. I think it's a real testament to those who were here with the Bellsbergs founding this organization, that they recognized all legs of that stool, right? And we've held true to that throughout the last nearly 50 years.
Yeah. And the brain is so complex.
Yeah.
And I guess one of my questions would be I can't imagine having the role that you have, because there's obviously such a huge need for so many different things and different legs of parts of the stool. How do you decide where the focus is for the research? Is there a process, or is it just who's coming to the table, or how does that actually work?
Yeah, that's a really great question. It's a little bit of all of those things, right? So, we're really lucky. Our Medical and Scientific Advisory Council is made up of incredibly smart, experienced, dedicated, very generous scientists who help us determine some of those directions, looking really at potential, new hot areas that may demonstrate potential that haven't been examined. As I mentioned, we have a scientist on staff who helps us all of the time, right? Not just at a couple of meetings a year, provide that direction. A scientific director in Dr. Joel Perlmutter at WashU and in St. Louis, who's incredibly generous and experienced also. So I think we look at areas that we collectively see that there's potential in. And if we didn't provide support for funding in that area, it might go overlooked. Really, the strategy behind our research program is to provide seed funding to get investigators that preliminary data that they now need to go to places like the National Institutes of Health and others to be more robustly funded. The days of going to NIH with just an idea and no preliminary data, unfortunately, are gone. So we look at both basic and clinical aspects of dystonia. We put an emphasis on collaboration because that's really important, on sharing data, which is also very important, and included in that negative results. I think there's a lot to learn from things that didn't turn out the way we thought they would turn out. We're looking at the mechanisms, pathways, hot areas for us are non-invasive dystonia, neuromodulation and dystonia. So looking at transmagnetic stimulation, focused ultrasound is an emerging area that we're looking at. Haven't funded anything in there yet, but genetics is always an area of interest, but a lot of dystonias are idiopathic. So what triggers it, right? We currently have a new project looking at the immune system and whether or not there are things in the immune system that may be triggering down the road a dystonia. So it's an exciting field to be in because there's a lot going on. Having our own scientists on staff allows us to not only just look at the grants that we've been funding and their progress, but the entire neurological landscape, right? So what's happening in MS that may have promise for dystonia? What's happening certainly in Parkinson's disease, Wilson's disease, other things that we should be looking at to see if there's something that we might want to explore for its applicability. Drug screening, big area, what we call repurposing drugs. So drugs that have been approved by the FDA for a different health issue, but maybe have potential to help us with dystonia, and then developing animal models. Right now we have a new project using a fruit fly and screening already approved compounds in the fruit fly system to see whether or not they might show improvement. So I think the other thing that the DMRF really looks at and takes very seriously its role in engaging young investigators, right? We look at it as our intellectual pipeline. We want to attract those younger scientists, both clinical and basic scientists. They look at things a little differently. They have a new, fresh perspective. They're incredibly bright. And we want to get them engaged and keep them engaged in dystonia research. And we have a really good track record with that and are really, really proud of the work that we've done in that area.
So if a scientist is watching this, a researcher, and they want to, hey, Janet, what's the process? Do they just go to the website, or what's that like?
They can go to the website. They could send us an email at dystonia@foundation.org. They can call the office and get connected. We would have them speak with our scientific director or our chief scientific advisor and get them engaged. We do requests for proposals usually once a year. So those get released in the fall, and we ask applicants to complete a letter of inquiry so that we have a general idea of what their project is. And then once those are reviewed, people are asked to complete a full application. So there's a standard process that we have in place, and we're happy to talk with them about that. So
perfect. And also in the same vein, the people that have dystonia, if people are like, how do I get involved in a study? Is that also something that's available?
So we can, if people are interested in participating in a clinical trial or a clinical study, that we usually refer them to the clinicaltrials.gov, which is a required registry of all clinical trials in the US. Okay. Unfortunately, there are not a lot of clinical trials in dystonia right now. Okay. There are some studies that there are opportunities for people to get involved in, and we can help connect them with those. So they can also email us at dystonia@dystonia-foundation.org or contact our office. And then, by phone, or we're happy to hear them out, because sometimes we may know of a program that's being put together, but it's not quite ready, for public promotion. And so, we take their names and contact information and get back to them. But if you're out there and you're interested in, thank you for your interest, because that oftentimes is the limiting factor for some of these studies going forward. So give us a call.
Yeah, no, I love that. So scientists and patients, or people that have this, that's an amazing opportunity. Let's shift gears a little bit from the science to the fun factor. I want to talk about Zoo Days. So can you share with the listeners and the audience, where did Zoo Days come from and what is it? And I'm so excited.
Yes. Well, and thank you for your leadership with the Twin Cities Zoo Day. We're very excited about that as well. So the concept came from Karen Flanagan and her family in Cleveland, Ohio. Karen is a person who is affected by a rare form of dystonia. And she wanted to create an event that would help to raise awareness of what dystonia is and how it affects people, while also raising funds for dystonia research. And it originally started as sort of a more traditional charity walk where they actually walked through the zoo. We know that for some people, walking is really difficult. So over time, and with the Flanagan, the assistance of the Flanagan family, the events have sort of now morphed into a day at the zoo, and it's really a celebration of community and a showing of strength to everyone in that particular area, right? So I have to tell you, there hasn't been one of these events that I haven't been to over the years where somebody is coming up to me and saying, this is the first time I've met somebody with dystonia. They thought they were alone and they didn't realize that there was an entire community in their own community of people who knew what dystonia was and who could be incredibly supportive. So it's really, it's a little different in every city, right? So some have raffles, which is what the Twin City has done. Not everybody does that. But it's a gathering. There's face painting, there's refreshments, a few speakers, not a lot, just sort of updates and welcome. And then people go out wearing these bright colored t-shirts to help this wave of awareness through the zoo, where people stop you and say, I've seen all these people in these t-shirts. What is this? And it's an opportunity for people to explain the zoo day, explain what dystonia is, and why it's important to create awareness. So yeah, they're fun days. It's really, really a fun day.
I love that. And I'm intending on connecting with some of the other states that are doing
Yeah,
it just to see what they're doing, because we can all learn from each other. And I'm so excited to be a part of that. And I love what you said, Janet, because here's the crazy thing. This is whatever. It is what it is. It didn't even dawn on me, okay, 8 years of this.
yeah.
You're like, oh, I wonder if there's a support group for this. And then it was last fall. And so I was able to participate in the virtual zoo day. I missed the zoo day in the Twin Cities because it was in June. And now it's like, oh, this is so fun. Kathy and I, another local Dystonia rock star, are organizing it this year. And I have met the coolest people. And I do want to give a shout out. This painting right here is by a fellow Dystonia warrior, Drew. He is essentially now a spray paint artist. And I just have to show off his painting because
Yeah,
this
please
will
do.
be at the Twin Cities. This will be auctioned at the Twin Cities event. This gorgeous,
Oh, that's
isn't
fantastic.
this amazing? So he's
That's really
donated this
fantastic.
to the foundation. And so um, I always find the silver lining in everything. And so the people that I have gotten to meet who also share this thing, we're pretty awesome and we're so creative. We're so creative. And I'm just overwhelmed by the local businesses who have said yes, they're donating gift cards, Chuck and Don's, a local pet store. I'm like, hey, some people that have dystonia have service animals. So this would be a really great partnership. And so it's so amazing when we can be open and just ask for help and share the connection, right? Because like you said, dystonia can be extremely isolating, and there's a lot of those, what they say, like non-motor symptoms of this
Right.
diagnosis. Feeling like you look like a weirdo, and then you don't want to go in public, and then it's exhausting, and so there's so many complex layers of this. So having something like the Dystonia Medical Research Foundation to have both the science, the awareness, and the support is massive. Now that brings up another question. I've seen some people, like specifically in Arkansas, if people do not have a formal support group, is there some way that the foundation could help them gather that, or how's that? What's that like?
Yeah, absolutely. So we have a member of our team here, Veronica Diaz, who is our manager of community engagement. Veronica's role is to really help those people form support groups. So again, people can contact Dystonia at dystonia-foundation.org, and we'll get them in touch with Veronica, or they can contact our office at 312-755-0198. And we'll get them connected with Veronica. I think, before COVID, we all weren't comfortable with that sort of virtual technology, right? So support groups were mostly in person, meetings. I know the Twin Cities group and Shauna and Brad Schmidt, who have done such a wonderful job in leading that group and organizing, the founders of the Twin Cities Zoo Days. We all sort of shifted when COVID hit, right? We are a resilient community, and we were able to adapt to the Zoom technology like others pretty quickly. So we can now offer both in-person support of the virtual support, or support of those who want to do in-person meetings, or a hybrid, which is what they've done in the Twin Cities area, which has worked out really well. So yeah, if you're interested, please help us. We also know that there are areas of the country where there may not be enough of a population base. So we have regional area directors and state coordinators to help people get connected with physicians in the area who know dystonia and can help work with you to develop a viable treatment plan, or other questions that they may have about things that are specific to states. So we're happy to get them connected. We also have online groups, Facebook groups. Our Cervical Dystonia Facebook group, which is a moderated group, so you have to ask permission to get in there, has more than 12,000 members. So, we've got a lot of support resources available for people. So I encourage you, if you're one of those people on the fence about whether or not you want to reach out, try it, because it may just be the thing that helps you take that positive step forward.
Absolutely. And speaking to that Facebook group, I just saw a great group of humans in Florida posting, they're gathering, and, people are like, oh, I wish I lived there. And so there's just so much power. Like if you don't have one and you know of one other person, that could be your group. And like Janet's saying, reach out, connect. Veronica, they can help you get set up. And it's so important to do that. And I would say my biggest regret, Janet, about this whole thing was that I didn't raise my hand sooner to say, hey, this here is no fun doing this solo. And while yes, all of my husband is amazing, the family, it's just that unless you have this, you don't really understand what it's like.
Right.
So there's power in that. And so I have this question I want to ask you. I know that you don't have dystonia, right? And you love working for this foundation. And this is one of my favorite questions to ask people that are navigating this. What has dystonia taught you?
Dystonia. First of all, let me follow up on your comment. I don't have dystonia myself. But after having been in this community now for a number of years, I feel like I have family members who do. So to the extent that anyone who doesn't have the disorder can understand, I feel like I do, and try to every day and learn something about dystonia and about how it affects people every day. But what dystonia has really taught me is the power of community, right? I mean, how what was it, Margaret Mead, who said, never doubt that a small group of committed individuals can change the world, for indeed it is the only thing that ever has. Yeah. We are that powerful group of small committed individuals, right? We are focused, we're passionate, we are going to close our doors forever because our need is no longer there. And with the opportunity to work with people like you and others, what the other thing that I've learned from the people in this community is just the generosity of their spirit, their willingness to share intimate health details with strangers so that the next person who's diagnosed can benefit. I've worked in a number of disease communities, and that is really remarkable and unique to the dystonia community. I mean, really incredibly generous people. So I just want to give a shout out to everybody in the community who has shared their story with a grocery clerk who wondered why your head was twisted, with a person at the movie theater explaining maybe why you have a little tremor in your head, somebody who is waiting for their vet, and they've got a tremor, or they're not able to reach a coffee cup and need somebody to help with that. Anybody who's shared their story with a legislator, an elected official, a neighbor, your doctor, anybody. Thank you for doing that, because collectively we're making a difference.
Absolutely. No, and yes, and thank you. That's hats off to all humans, especially who have this. And also a shout out to those of our loved ones who are also uber supportive, because Lord knows that's not easy either. So like super shout out. And one final question. What would you like the world to know about dystonia or the foundation before we go that you think would be important to share?
Yeah, I think that the DMRF understands what dystonia is. And there's a place for you here. Come join us in this fight. If you're not connected yet, or you're not feeling like you could be, there will be a time when you can be. And giving back to the community is really good for your health and your well-being. We are a group of, our board are all individuals who are affected personally by dystonia, either they themselves or a loved one. And everyone is really passionate about achieving our mission. So whether you want to be an advocate or an awareness warrior, or you want to help us with a new support group or an existing support group, we can find a place for what you bring to the table, and would welcome you sitting at that table with us and joining in this fight.
Mm. Oh my gosh. So rich indeed. Janet, thank you so much for being a part of this incredible foundation. I am extremely grateful for this foundation, and of course the research. And I will post all of the links that you shared in the description so people can easily click on the links. And again, just thank you. And hopefully if you're listening, you have been inspired, you have been empowered, and you know above all else that you are amazing. And also the foundation has your back, and we hope to play with you soon.
And thank you for all of your work as well. This has really been a delight to talk with you today. Thank you so much.
Absolutely. It's my honor and privilege. So thank you. And we're gonna sign off. Thank you.
Thank you.